One of the best ways for a physician or nurse practitioner or healthcare professional to stay out of trouble is excellent documentation. And oftentimes the absence of that documentation will cause certainly trouble for them now and in the future. Documentation is essential not only for good patient care, but also for the potential perhaps of liability down the future. But one of the things that they should document, when prescribers are engaged in documentation, it not only is to the benefit of the practitioner, it's a benefit to the patient. And so they need to document such things as certainly the fact that a patient evaluation, assessment, follow-up, PDMP, prescription drug monitoring program, document the fact that they have actually followed, pursuant to a state's rules or guidelines, that they have been complied with. And if they deviate, for example, from recommendations, they need to articulate clearly why they did. And then once they've been able to document that, should something occur, they should at least feel a sense of somewhat relieved that it is in the medical record, but they certainly would not want to go back and change or add to that medical record in the event that a situation has been presented regarding some type of issue relating to patient care. One of the questions is that what type of attorney should I get? Do I need to get an attorney? It's all about preparation. When the Drug Enforcement Administration or some regulatory body shows up at your office, that is not the best time to be looking through the yellow pages to find an attorney. This is something that you should plan in advance. Now, it's something that need not be cost prohibitive, but it's just part of your own documentation, part of your own business planning about should the event arise, you have a backup. You have somebody that you can call. And you may want to consider calling more than one person in the event that that first person on your list is not available. But you should have somebody that is experienced in the area of medical regulation, and that has a background in this area. They need not do it 24/7, but chances are a physician who's interested in getting a list of attorneys in the event that something should happen, would probably not want to put somebody who specializes in real estate, but rather something in the regulatory field. There's a variety of ways that clinicians can become a voice for positive change, because the primary thing to consider is you need to be at the table. You need to be involved in some way of affecting change, because if you're not at the table, you're going to be on the menu. As a result, you should think proactively. Make your voice known. Now, it can be simply at the local level, in your city, in your state. You can write letters to the editor. You can contact state medical boards. You can contact elected officials and share with them compelling stories. Because although as scientists we appreciate empirical data, don't underestimate the value of a good, compelling story, because that's what politicians like, and that's a hat that they can hang on. Those policymakers, broadly defined, need to know the negative impact that many of their well-meaning policies are having on real people in pain. So it's better to do something than nothing. One of the ways that the clinical community can be a voice for change as it relates to reimbursement is that denial of coverage is denial of care. And although, for example, the CDC has recommended that non-pharmacologic therapy be pursued, what the missing piece is that an awful lot of non-opioid or non-pharmacologic therapies, alternative treatments, are not covered by insurance. And as a result, it leaves few patients and few practitioners with little else other than opioids. And so what needs to happen is that the clinicians need to be able to make their voices heard as far as the expansion of those reimbursement and those alternatives, because integrated multimodal care is essentially an effective approach.